My primary area of expertise is acquired neurogenic language disorders. That's any kind of problem with communication that arises in an adult who's been able to communicate naturally and just fine, but then has some change due to a neurological incident. So it could be some form of dementia, a degenerative process in the brain, or it could be a stroke or a brain injury. A major clinical challenge we have in working with people who've had any kind of neurological disorder is that everything is interconnected in the brain. So many of the assessment techniques that we have to figure out what's going on in the brain of an individual who's had a neurological disorder are confounded by all these different symptoms and problems that could interfere with one another. We often think we know what people understand based on how they respond to us. So if we're in a natural conversation and they're responding on topic and interacting with us naturally, we have a good idea that they understand us. If we show them a set of pictures and ask them to point to the picture that goes with the words that we're saying, and they do that correctly, we know they understood. However, there are a lot of reasons that people after a stroke or a brain injury may not be able to do those sorts of things, or may not do them well. They may score poorly on a standardized assessment for comprehension, for example, when in fact they don't have such difficulty comprehending. What we're trying to do is find new ways to get around some of the response confounds, some of those things that keep us from really knowing what a person understands, so that we can get a better picture of what they really understand.